Hello, everyone. This is Dr. Koenig, and this is Chapter 2 in our course HS 3113. And this chapter is on the counselor, or the group counselor in particular. So let's jump right into this. As a person, some of the issues that face us as group leaders is fear of making mistakes. And we all do this. And I don't mean we all are scared of making mistakes. I mean, we all make mistakes. Every single one of us is human, and it's at some time or another, you're going to make a mistake as a group leader, as a therapist, whether it's individual or group. So use supervision, use consultation, and later in this chapter, we'll talk about co-facilitation, which is also really helpful. And I have led groups that I've done individually, and I've also led groups as a co-facilitator. And it's really nice if you have very many people to have a co-facilitator because it does, I think, reduce mistakes, and you guys can, if you have a good relationship with your co-facilitator, you can really assist each other, and I think the group benefits from it, as well as the facilitators. Um, Sometimes people get scared of dealing with negative reactions from members of the group, and this does happen, and we all sort of have to figure out how to handle that to the best of our ability. Um, Sometimes we can use this as sort of grist for the therapeutic mill, and use it constructively within the group. It does take time to develop group leadership skills, so cut yourself some slack. Um, you are at the undergrad level now, so this is something that you should be starting to learn. And if you are not perfect at it, I would not expect you to be. So try to get some feedback, whether it is from a supervisor, whether it's from a co-leader, whether it's from individual members of the group. Whenever the group is over and they are, talking about, their experience in the group, or filling out that form that they often do at the end of what their experience was, what they could do better, or what you could do better as a group leader. Ask for that kind of feedback, and group leaders generally will give that to you. I'm sorry, group participants will generally give that to you. Okay, so personal characteristics. It takes courage to become a group facilitator, because oftentimes it is one facilitator and you've got 5 or 6 group members. So you have to be able to lead 5 or 6 people who have generally some type of personal problem or mental health issue. You have to be willing to model the behavior that you're trying to teach. And none of us do things perfectly all the time. So you might mess up in modeling whatever behavior it is you're trying to teach. If that were to happen, it also is a very good way to role model what to do whenever you mess up. So no matter what happens in group, as long as it's not something outlandish, generally it can be a teachable moment. Being able to be present can sometimes be a tall order when you're dealing with a group. If you are a lone facilitator and you have 5 or 6 or 8 or 10 members of group, if you're dealing with an individual, it's much easier to be focused and attending to that one individual. It is much more difficult to have 10 people in a room and to be attending to each of them as individuals, as well as to the dynamics of the group. So it can be much more intense, especially when you're first learning how to do that. Having just being genuine, being caring, and wishing well and good things for other people, and doing that sincerely is very important, and important characteristics to have. And then just believing in the process of group. Um, I don't think I really understood group process when I first started doing groups. And then something changed when I got into doing counseling groups, and I got to a group that got into the working stage. And it was something that is bigger than the sum of the parts. Unless you've experienced that, it's hard to describe. But it was a really, really good, positive experience, and something that I wanted to see if I could recreate in every group thereafter. Not all groups are intended to be counseling groups or psychotherapy groups. But those are my favorite things whenever I'm able to do those and we get to that working stage and you can see people changing before your eyes. It's very inspiring. Let's see, openness. You have to be willing to be open with the group participants in an appropriate way, of course. You have to be able to take some criticism, or to have group members say things to you or about other members in the group and respond in a non defensive way, in a way that doesn't shut down conversation necessarily, but directs it into a positive path. You need to really be aware of cultural issues, even ones that are subtle, with yourself as well as with others. Being able to empathize with a client's pain and to reflect on how well or not well you were able to do that. Understanding your own personal power and understanding how to use that in a way that uplifts other people. We should never use our personal power or our professional power in a way that's detrimental to anyone else. And then it does take some physical stamina as well as psychological, and it doesn't say emotional stamina on here, but I think it also takes emotional stamina. Self awareness, we said this in the last chapter. We need to know like who we are, how we came by our own identities, what our privileges are, what our motivations are, and what our limitations are. A sense of humor. This is one of the things that I have found to be invaluable, whether it's in group therapy or whether it is in individual therapy. If you are a witty person or you're willing to laugh at yourself, you're willing to see the humor in things. And you do have to be careful about this, and you have to know, you have to have a relationship with the group or relationship with the individual. But this can be one of the most useful tools that you will have in your tool belt as a counselor or a group leader. Inventiveness, we do get to be very creative whenever it comes to group, whenever it comes to designing interventions, or redesigning an intervention that we found. One of your assignments is to, find icebreakers. You can adapt those icebreakers in whatever way is needed to suit your purpose and your group. So you can always try to keep it fresh, and there are certain things probably that you will find you have on your favorites list, and that's fine. They're the standbys that you go to a lot, but you can always also alter those things. So it does take dedication and commitment to leading a group, because it can be really tiring and it can be emotionally exhausting depending on what type of group that you're leading. If you're leading a group of sexual abuse victims, you're going to be exhausted. And that's to be expected, because there's a lot of trauma there, and processing that, reprocessing that, working through it, hearing and understanding someone else's trauma can be very emotionally taxing. So, you also have to have a really good self care plan and make sure that you're maintaining your own wellness. Okay, so as a professional, and I think there's a lot of crossover between the personal and professional there, um, especially when it comes to self care and wellness. Okay, so skills we use as a group leader: active listening, of course, reflecting, clarifying, summarizing, facilitating, empathizing. These are all things that we use as any type of counselor. So, of course, we're going to use them as a group counselor as well. Interpreting and questioning, linking, confronting, supporting. Again, all things that we use whether we're in an individual setting or whether we're in a group setting. Blocking. Blocking is something that it looks a little bit different if you're in a group rather than with an individual. So, with an individual, we might intentionally not attend to something if we want to hit the brakes instead of the gas pedal when it comes to a person who maybe is sort of perseverating on something, or they're stuck there and they can't get beyond it, and they just sort of keep on with this theme and we need to move on. We just might selectively not attend to what it is that they're continuing to perseverate on. With groups, we have to take a more active role. So that might mean taking control of the group if someone is bombarding someone else with questions, if they're using a really indirect communication style, if someone decides that they're just going to, tell a really long story and eat up 15 to 20 minutes of group, and there's really not a point to this story that is on theme for the group. If someone in the group decides to break a confidence, um, either in the group setting or outside the group setting, those are things that we need to block happening. Assessing is something that we do in both individual and group, but in group we have the added dimension of assessing the group itself as an entity and as a um, I guess as a an entity and what stage that the group is in whenever we're making those transitions from one stage to the next. As a group facilitator, we don't have those dynamics whenever we're working with someone individually, but we need to constantly be assessing that. And then modeling is something that we do in both individual and group, but it may be more challenging in a group because when you're doing it with an individual, you don't have 8 or 10 people um, that you that possibly are um, creating either a distraction or maybe not necessarily a distraction, but your attention is not divided 8 or 10 different ways. It's just focused on you and the one client that's in front of you. Suggesting. We do this in individual therapy. It's really no different in group therapy, except we may aim our suggestion at multiple group members, or we may suggest an activity between group members, which we wouldn't do, of course, if it was an individual. We might suggest something for them to do, or we might suggest they do something with us, such as a role play or something like that. Um, we take the initiative oftentimes in both individual and group therapy. We're always in the process of evaluating. And then termination. Termination is a little more complex when it comes to group because every member of the group can react a little bit differently to termination. And we have to be, again, aware of 8 or 10 different people's individual processes toward termination and where each of them are at instead of one individual. If you want to take a break, now would be a good time. So let's talk about the co-leadership model. The basis of co-leadership, there are a lot of advantages to co-leadership. I mentioned this, I think, when I was introducing this chapter. I've had the opportunity to co-facilitate groups, and that was a really good experience because the person that I was co-facilitating with, we were we got along really, really well. We were close colleagues, and we could sort of play off of each other. We knew where each other was going, and we could move the group along sort of in a certain direction, with a just because we knew each other very well. So it is really important to talk about group before you go into the group so everybody's on the same page as far as what the goals are. It's also important to debrief after group. What went well? What didn't go so well? What were you thinking when you said this? Well, I was hoping you would jump in with that. Those types of conversations. Or maybe that didn't happen, but we got there in the end. How we could be more efficient in getting there the next time. Those kinds of things usually get discussed in a debrief. Co-leadership is great if you are a new group facilitator, and someone who is more experienced will allow you to co-lead a group with them. So you can be the person who is sort of chipping in. You might start out as more of an observer, and as your comfort level increases, then you can participate more and you can co-facilitate more. It's always great to have co-leaders also because we do sometimes get sick, and it is really nice to have co-leadership in that you can lead a group individually for one session if your co-leader is ill, or if you're ill they can do the same for you, and the group can move forward without being canceled. So that's always really nice as well. So one of the things that you really need to do or avoid doing, um, if you're co-leading a group, you should not sit side by side. You should sit where you are facing each other across the group, so you each can see each other. You can make eye contact, um, and you can see each other's nonverbals. Um, Having a goal for the group, but you don't communicate that goal to your co-leader. And this is why you meet before you start the group, just to double check that you're both on the same page. Co-leadership is about collaboration. It is not about competition. So it's not about who the group members like best. It's not about who gets the floor most of the time. It is about smoothly leading a group of people into discovering something about themselves they didn't know before, or teaching them skills they didn't know before, letting them have an experience or re experiencing something that gives them insight. Um, it is not about trying to be more powerful than the person that you're co leading the group with. It is not about being right and making your co leader wrong. And it is not necessarily about being quiet and letting your co leader do all the work. Now, one caveat to that: if you are just learning and you're co leading as part of learning how to be a co leader or a group facilitator, then that might be exactly what it is that you need to do. You might, and you might even express that to the group. This is, as the group starts, you might be introduced as, I'm learning to facilitate, so I might not take as active a role as my co-facilitator in the situation. But as the group goes on, I may become more active. I would just, own that, put it out there, and then, watch the co-leader. And as you and the co-leader sort of evolve through the group process, you're going to confer before each group. You're going to debrief after, and the more comfortable you get, probably the more you're going to speak up. And you may even decide between the two of you, okay, you're going to be the person who's going to introduce this, or you're going to be the person who's going to, introduce that, or try to process this particular area with the group, or do this exercise, those kinds of things. Hopefully, you can decide that before the group starts. and then as the group processes through its sessions, take more of an active role. So advantages. This talks about burnout being reduced. I think it is hugely reduced when you have a co-leader if the relationship with the co-leader is one that is collaborative and supportive. Um, like I said, I've had really good experiences with having a co-leader. Not everybody, I guess, has had that type of experience, but if it is somebody that is supportive and collaborative, you don't get burned out nearly like you would if you're doing it individually. So there's more possibilities for linking people, for facilitating interactions, for working on the flow. Um, you also have peer supervision and can give each other feedback. So, after the group is over, when you're debriefing, is a good time to do that. Um, Countertransference can happen in a group and for group facilitators, just like it happens in individual therapy. So if I am having a strong countertransference reaction to something that's going on in the group, hopefully my co-leader is not having that same experience. And I can lean on them during that particular time. And if they have, something going on at a different point in time, they lean on me. And that way, we're complementing each other. Let's see. There are also advantages when it comes to differences in power and privilege, ethnicity. Every diverse identity that you can imagine, co-leadership lends itself well, because there is more diversity when you've got two people than if you've just got one. Okay, developing a research orientation to practice. Group therapy sometimes is seen as lesser than individual therapy. And I think that depends on the quality of the therapy, both individual and group. Because if you are in a group that is very well run and it is a group that's working productively, it is a thing of beauty. You can also have great experiences as an individual. Or you can have a group that maybe is not well run and is not a good experience, but you can have the same thing in individual therapy. Maybe there's a mismatch between the therapist and the individual, or something else where just, that individual and that therapist is not a good fit. So I don't think you can make a blanket statement that individual is better than group. Both of them can be very good, and they can lend themselves to different aspects of growth. So when you're in a group, you're going to get feedback from 6, 8, other people. Whereas when you're individual, you're going to get feedback from the therapist, but that might not be as powerful as the feedback that you're going to get from an entire group of people. So that aspect of it, I think, can be more effective in some ways than individual therapy. We do need to understand what groups are available and the suitability, be able to judge the suitability of an individual for group, or whether that person is just not suitable for group and they need to do a little bit more individual work before they become suitable. Research on group, there's not a whole lot of it. Um, your book talks about group research that's going on in Germany, Norway, and Canada. And I would encourage you to read a little bit more about that because it is very interesting. But I'm not going to go into that here because I know that you can read that for yourself. The two models that are used the most are behavior therapy, cognitive behavioral therapy, and psychodynamic therapy. So the research that's out there does support the effectiveness of group therapy and across a wide range of mental health concerns. And it can also be a lot more economical if there's a mental shortage of mental health practitioners. One of the solutions can be, you can see 8 people in an hour and a half for a group on depression, whereas you can see one person for an hour if you're doing individual. So if there's a shortage of mental health clinicians, groups are a good way to sort of maximize our resources. We also want to make sure that every program that is teaching folks to do counseling, that group is one of the things that's included in that, because it is something that we have a responsibility to teach. Common factors. I think everybody knows what common factors are. The common factors that sort of underlie all theoretical systems and that make mental health counseling productive. So, one of those common factors is just the relationship between the counselor and the client. And the quality of that relationship is responsible for a large portion of how um, how productive that therapy is going to be for the individual. So the better relationship, the better the outcomes. Let's see. Um, there are gaps between research on group counseling and practicing group counseling. A lot of that is because practitioners are busy practicing, and sometimes they don't take the opportunity or have the opportunity to learn about what is new in the research world, what has now maybe been shown effective. Um, so what happens is new research that's out there that demonstrates effectiveness is not always integrated into clinical practice. Sometimes that's because the person doing the practice just doesn't have time to explore it, or sometimes it's because the way the research is done, it maybe doesn't lend itself very well to practice because it's more experimental in nature.